Being diagnosed with a genetic disease is shocking for a lot of people. Fortunately, there are red flags that can calculate your risk years before any diagnosis is made. Kevin Sweet is a licensed certified genetic counselor and professor at The Ohio State University. When patients come to him to assess their risk factors, he sifts through their personal and family medical records, looking for certain patterns. Take, for example, hereditary cancers.
Some of the red flags for hereditary cancer in a personal or family history might be young age of diagnosis. So most individuals diagnosed with, say, breast cancer are in their 60s and 70s. But if an individual is diagnosed under age 45, that sends up a red flag. Or if there's multiple generations of individuals affected.
After diving through the medical history, Sweet uses all the data to build a risk assessment for the patient. If they seem to have a high probability of developing a specific condition, Sweet will then offer genetic testing. This process looks for mutations or variants within DNA to either make a diagnosis or clarify their specific risk factors. As a genetic counselor, Sweet helps patients navigate through all of this new information.
Meaning, well, if you are at increased risk, what does that mean? What steps might one be able to take? What are you doing currently for your screening and prevention? And then also in a larger scheme, how might this apply to other family members? So genetic counseling is kind of, in the area of cancer, which I do, a little more focused on risk assessment and actions and even prevention and treatment. Genetic counseling in other areas, like, for example, there's genetic counselors that do prenatal. Well, that's a different type of more acute crisis counseling.
The National Society of Genetic Counselors reports that there's around 5,000 licensed genetic counselors in the U.S. Colleen Jodarski is a prenatal genetic counselor at the University of Maryland School of Medicine. In 2023, she published an article in the Journal of Community Genetics that discusses how genetic counselors should tailor their approach based on the specific disease. For example, XYY syndrome.
XYY is a sex chromosome aneuploidy. And so we all have chromosomes, which are what package our genetic information. And normally we have 46 total, so 23 pairs. And the sex chromosomes are what determine biological sex. And so individuals who have inherited an extra Y chromosome from their dad.
The symptoms of XYY are primarily cognitive. Many boys experience language and motor delays, as well as behavioral challenges such as ADHD or autism.
There are some physical characteristics like tall stature. Sometimes their eyes are a little bit closer together, but primarily the presentation affects more of the brain development and manifests that way as opposed to physical symptoms.
But the condition is only found in males. About 1 in 1,000 boys have it, but Jodarski says that number is most likely a much lower estimate than reality.
It's probably more prevalent because we're realizing now that there's a greater spectrum and we're screening for it more routinely in pregnancy as well. So people are finding out, whereas in the past, they would only find out if there was a presenting issue, and that led them to seek care.
While genetic counseling has been around for decades, the field is just now starting to explode. In fact, the Bureau of Labor Statistics says it's projected to grow 18% in the next 8 years, which is much faster than the average occupational rate. Sweet hopes that genetic counseling becomes a common practice for everyone, especially those who have questions about their health risks.
Maybe there's something in the family, whether it be cancer, heart disease, or Parkinson's disease, or diabetes. And just not only learning more about your risk, but again, maybe action steps you can take. So in some ways, almost any individual might benefit, but definitely folks that, again, there might be some red flags.
Sweet says that combing through family history is usually a great first step. But what about people who are adopted or don't have access to that information? In this case, Sweet goes straight to genetic testing.
The testing has gotten to the point that even if we didn't know the family history, it could be helpful. So we know that there are certain genes that cause increased risk for hereditary breast cancer. There's about a dozen of them. There's a good handful of genes that cause hereditary risk for colon cancer and uterine and ovarian and so on. So nowadays, we can take a blood sample or a saliva sample, and we can look at each of these genes in what we call a panel test. So we could do a quick, thorough search for hereditary risk factors for, say, cancer, even without a family history, if an individual has concerns about their risk.
Unfortunately, we don't yet have one test that can assess a person's risk for everything from cancer to cystic fibrosis. Sweet hopes that we'll be able to look at these various genetic data points in the future, but the current tests are much more specialized.
We don't have one catch-all test, but at some point in the future, this testing will become more widespread. It will become more commonplace. And it will be able to help individuals, again, not just for a lot of these common diseases like cancer and heart disease, but also rare diseases. And even potential genetic determinants for reactions to medications. How you might respond to a certain cholesterol medication or a blood pressure medicine could be determined in your genetic makeup. And those types of tests will become available, I highly suspect, within the next 5, 8, 10 years.
For now, Sweet recommends talking with your primary physician to see if you're a good candidate for genetic counseling, especially if you're pregnant. Jodarsky says expecting mothers should consider having a non-invasive prenatal screening.
It's a blood test that's able to look at fragments of placental DNA that are circulating in mom's bloodstream, and is able to evaluate for those different conditions based on those DNA fragments.
The prenatal test identifies the baby's risk for certain diseases. If the child does have a high risk, then doctors will conduct diagnostic testing that will see whether they have the condition. But what's the advantage of doing genetic counseling during pregnancy instead of waiting until the baby is born?
The benefits of finding out prenatally are they allow parents to better prepare. So having information ahead of time, they're able to make decisions about early intervention, which is associated with improved outcomes in children that have XYY and other conditions as well. It's helpful to have the information up front. And that's what we've heard too, or at least what I've read too in the literature, when parents of children with sex chromosome aneuploidies have been interviewed about their experience. Wanting to have that information up front is helpful in planning and seeking out those opportunities for their children.
Every state offers early intervention programs that are publicly funded. Many of these services are free for eligible children. Jodarsky says these courses can be especially beneficial for kids with XYY to help them with early language and motor skill delays.
Once you're in the school age, it's individualized education programs, so having an IEP, being able to get assistance with learning.
Genetic counselors are there through this whole process to continually bridge the gap between the diagnosis and the intervention strategies.
And so the goal ultimately is to refer people to like a pediatric genetic specialist or genetic counselor, just to be able to help, come alongside families and help them feel like they're not alone in navigating this diagnosis. Because that was something I came across both in the literature and anecdotally when speaking with families about their experience.
Before Jodarsky's recent review on XYY syndrome and genetic counselors, the last paper of its kind was published in 2002.
And so a lot has changed since then, and as far as our understanding, and the biggest thing being the variability of the XYY phenotype. So realizing that there's a much broader spectrum than what we've seen historically in the literature too, because typically what gets published right away is the most severe cases, because that's what's coming to people's attention.
But Jodarsky wanted to provide a complete look at the condition. She hopes this review gives healthcare providers a better understanding of XYY syndrome and provides a roadmap of how to approach the patients and families dealing with this condition.
There is greater uncertainty given that we're realizing the variability of this phenotype, but helping families by providing anticipatory guidance and things to look out for when counseling primarily motivated this.
The more we learn about genetic causes of disease and actions we can take to potentially help lower risk, I kind of look at that as potential benefit for, society in general.
Sweet says that as the field grows, genetic counseling is becoming more accessible, especially now that the cost of testing is going down.
Some of the breast cancer genes were patented. So it used to be $3,000-$4,000 to look at 2 breast cancer genes. Well, now for $250, with or without insurance, we can look at the whole range of hereditary cancer genes in one panel test. So it's become more cost effective in cancer genetics, and we can do more with it.
In fact, you can take the very first steps in the comforts of your own home. Sweet is the director of the Family Risk Health Calculator, which is an online tool developed by The Ohio State University. It's a free website that assesses a person's risk for cancer and coronary heart disease.
So if you have a concern or have interest about, is my family history of cancer or heart disease something I should be concerned about? Should I consider having genetic counseling and testing at whatever age? If you're a teenager or in your 20s or in your 60s, you can go to this free website, put in your personal or family history. So if you've been diagnosed with cancer or if you have a family history of cancer or heart disease, And we've developed risk assessment algorithms that are in the background, and they assess risk, and then they compute what your risk is. Are you at elevated risk? Is there something there, some red flags for those two diseases that maybe you would benefit from genetic counseling and testing? So really at any given age, you could learn more about your risk by using some of these family history tools.
You can find more information about Kevin Sweet, Colleen Jodarski, and all of our guests on our website, radiohealthjournal.org. This segment originally aired March 2023. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.